All right. So today's the day. Just finished a full morning of testing patients, and today is the day. And if you're wondering, what the hell are you talking about? Today is the day that myself and a bunch of my colleagues are getting our COVID-19 vaccines. Definitely long awaited and definitely highly coveted. I mean, a lot of people are wanting the vaccine and they can't. A lot of my colleagues, want the vaccine, but they're not working in a specific position or specific field, so they can't get it either. And there are a lot of people that are nervous about it, and I have a lot of thoughts about it. Okay, so the thing is, I've been doing testing for like almost the entirety of 2020, and so I'm in the front lines testing people damn near daily. I've seen patients test positive. I've had patients that I've been personally involved with their care test positive, and I've had a lot of friends and family who have tested positive. Some of them have gotten really sick. Some of them not so bad. I mean, it really depends on the person and any underlying conditions or their age or immune response and things like that. But I'd really wanted to talk about why I'm getting the vaccine, and it's complicated. I mean, a lot of people have different feelings about it, but first and foremost, because of what I do, I'm putting myself at risk on the daily. Fortunately for me, I live by myself with me and my dog, but I do want to make sure that I'm being as safe as possible, and that I'm also personally getting tested every 1 to 2 weeks, and that it's been that way since March. I have a standing order I was testing myself at work, and then I got a standing order with my healthcare provider, my primary care, and I ended up just making an appointment every week or every 2 weeks, depending on my schedule, and getting tested. And fortunately for me, everything I've been doing is good because I've been consistently negative. Okay, but that being said, this pandemic, this COVID-19, isn't going to go away on its own. A lot of these other countries were able to kick it, not completely, but knock it down a lot better than we have in the US much earlier on. And unfortunately, the attitude and the culture here is slightly different. I mean, we have self-serving, self-fulfilling attitudes here. A lot of it is being just feeling privileged and above the rest kind of thing, and that's just what it is. It's just the culture, the society. I'm not here to dog on people specifically, but it's the fact of the matter. People just don't want to wear the mask. They feel like their liberties are being infringed on, and it is what it is. Individualism and freedom is big, and because of that, we've been getting worse and worse waves and surges in infection, and people needing to go to the intensive care unit. And at some point we've gotten to a point where we have 0% capacity. We can't see any more people, and it's taking a huge toll on healthcare workers, emergency healthcare workers, and intensive care unit employees, staff, support staff, and doctors, and especially on our resources and equipment. So that's when things get super dangerous, is when we can't take care of people and we have no space. Like, literally, where are we going to put them? In the hallways? Like, no. So there's that. And I just wanted to touch on, like, a lot of my friends and family who have had, I say a lot, but it's not a lot, but like more than I would like, preferably 0, but like I've had friends who've recovered completely, and I have people who have lingering repercussions, like they can't walk up the 10 steps up to their house without gasping for air, and they used to be super athletic, played soccer, CrossFit athlete, and all that. And I have, a personal family member who is still going through rehab. Fortunately, they were put on a respirator, but they got past it, they recovered, and now they're making a pretty strong recovery. Yes, they're in their later years of life, but they're fortunate enough to have the resources to dedicate to their recovery, and not everybody's in that position, and we have to recognize that privilege there. So there's that. But getting off my soapbox, what we're getting today is the Moderna vaccine. It's the two major vaccines that we have in the US are Pfizer and Moderna. And I want to talk a little bit about the differences. And I have a little cheat sheet here because there's just so many intricate things that I feel like people would just want to know. So Moderna versus Pfizer, okay? So Moderna, it's both shots are, you got to do an initial priming vaccination. And then after that, you do a booster. So Moderna is 28 days. So you get your first shot. I'll be getting my first shot today. And then 28 days later, I'll be getting the booster. For Pfizer, I believe it's 21 days. So it's 7 days shorter, okay? In terms of efficacy or how well it works, they're pretty much almost the same. If you look at it, Moderna has a 94.1% efficacy rate of, giving protection, whereas Pfizer has a 95%, so it's only a 0.9%. The main difference there is Moderna is measured 14 days after your second shot. Pfizer is measured 7 days after your second shot. So basically, with Pfizer, you're getting 95% protection a week earlier than Moderna's 94.1% 14 days later after your second shot measured, okay? But there's a couple other things that you got to think about. It's not just that, right? So Moderna is rated for 18 plus. It sounds like I'm talking about video games or movies or whatever, but like the vaccination, the emergency use authorization requested that basically Moderna vaccine is going to be used for patients 18 or older, whereas Pfizer is 16 and older. So you got an extra 2 years there. But here are the major differences. The Moderna vaccine uses 100 micrograms of per injection, whereas the Pfizer uses 30 micrograms. So Pfizer, you use less. You're injecting less into the patient. But the major difference here is storage. And this plays an important part, and I'll explain a little bit more after this. Moderna, you can basically keep it at -4 degrees Fahrenheit, which is the warmest it needs to be, and lower, whereas Pfizer, you need to keep it at -76 degrees Fahrenheit. And for those of us who use Celsius, Moderna is -15 degrees Celsius, whereas Pfizer is -60 degrees Celsius, which means more people as in clinics and hospitals and things like that, can actually have the Moderna vaccine because you just basically need a freezer that works. Whereas with the Pfizer one, you really need a specialized pharmaceutical grade freezer that's going to be able to go as low as those temperatures. Which plays a big part because a lot of places don't have a specialized freezer for that. But being able to obtain a freezer that's getting you down to -4 degrees Fahrenheit, that's very achievable. And I guess I'll talk about it now. It's like, yes, in comparison, Pfizer, you're using less vaccine per injection. You get a 0.9% higher protection 7 days earlier. I guess that's 2 points there. But however, chain of custody and logistics. If you think about it, you have to take it out of the freezer, you have to draw the vaccine, you have to inject it into the patient, and a lot can go wrong. If the vaccine logistically gets left out and it rises above that temperature, it's a little too warm, we don't know whether or not that's going to be as good or if it's usable at all. You basically waste an entire vial of vaccine. Whereas Moderna has a little bit more wiggle room. Not only can more people and more clinics and doctors, be able to get the vaccine, store it properly, and do it and administer it. But there's a lot more wiggle room, because if the temperature rises past a certain point, it's still viable, it's still good. Whereas Pfizer, you really need to keep it super, super, super cold. And so logistically speaking, we can actually get the Moderna out to more people and have it be a gooder or a better vaccine. That's a big part of it. But you know, I like to like also tell people, it's not, we don't have the luxury of, oh, I want this one, I want that one, and choose. Because the thing is, we don't have enough vaccine, you know, and whatever you're able to get your hands on, you should get that one. Because right now it's about protecting as many people as fast as possible. So if your hospital, your primary provider gives you a Pfizer vaccine, great. If they give you a Moderna vaccine, great. But you know, all these little details that I've gone through and talked about, it's little details, and it really shouldn't affect your decision. Because if you're able to get any vaccine at all, count your lucky stars, because boy, a lot of people are not able to get it. Okay. Let's see, a couple other things I wanted to talk about. How does it work? So both these vaccines are not attenuated viruses. You know, it's not like they're giving you a dead virus and you're having your body do whatever. They're actually using mRNA, which stands for messenger RNA, which is basically parts of the DNA. Long story short, biology, physiology, all that out of the way, throw that out the window. Let's use normal English. Basically, the parts of the virus that tricks your body to having a immune response. So your body creates a defense system for it. And so you're not even getting a full virus in your body at all. So there's actually no way for you to get COVID-19 from this specific vaccine. So that should ease a lot of people's, you know, minds when people think, oh yeah, give me the vaccine, but then like, what if I get COVID? It's like, you can't get COVID from the vaccine itself, because it's not even a full virus. It's parts of the DNA itself, and it tricks your body into creating an immune response. And on that note, it is taxing on your immune system. And so things that you could do to prepare yourself for the vaccine would include, you know, drinking lots of water, boosting your vitamin C intake, eating healthy, sleeping well before and after, you know, during the time that you're getting the vaccine. That way that you can minimize your body going crazy about it. Yes, there are people who are allergic to it, but it's you get that with anything. I mean, even with a flu vaccine, you can get people who are allergic to eggs. You have to have a specific one, and at this time, this is the vaccine that we got. And so that is why today, when I go get vaccinated, getting the injection isn't going to take very long, but they're going to keep us there for about an hour for monitoring if we have any, you know, anaphylaxis or anyone who has a severe allergic response. You're already there. They're already monitoring you, and they're going to be able to take care of you immediately. So, you know, precautions are being taken. And as you can tell, like, I'm talking really fast right now, and like, I just want to talk about how I feel. I'm definitely excited. Definitely anxious. And the anxiety, not necessarily about like, oh, what can go wrong. You know, with anything, even if you take a Tylenol, something can go wrong. You know, that's the most commonly taken over-the-counter and prescribed medication that anybody can get their hands on. But something can go wrong. There's always side effects, but I'm not too worried about it, because people are saying, oh, they pushed it out really quickly. Yeah, they pushed it out really quickly, but, you know, things are done within compliance with safety in mind, you know. A lot of reviews, a lot of study has been done. And I am actually pretty confident in our science and our technology and the people who are tasked with creating this vaccine. So I'm not worried about that. I guess my anxiety is more just in preparation for the feeling of liberation. Am I going to walk around without a mask? No. You know, am I going to be irresponsible and start hanging out with a bunch of people as if nothing's wrong? Absolutely not. Because the fact of the matter is, the vaccine, when we talked about the percentage efficacy or how well it works, it doesn't always, it's not one of those things that, oh, you have a force field and it's going to get rid of the get rid of COVID-19. What it is going to do is help your body create a defense system, your immune response, and your body is like, okay, this is not the first time I've seen it, I can kick its butt. So therefore, yes, you can contract the virus. Whether or not you become symptomatic is a completely different thing. But what we do know is that because your body has the defenses primed against it, you either could still get sick, but it's going to be a ton less severe, to the point that you don't even need to go to the hospital. It's just like a common cold, couple days, a week, whatever, and you're fine. Or it could even be the fact that you don't even have a get sick period, and your body just kicks it and you're fine. It could be just like that, and it was great. So there's still not a lot of information whether or not you can still transmit the virus if you're a carrier. Just because you're asymptomatic, as in like you have the vaccine, you're protected, but you're not exhibiting any symptoms, doesn't mean that you can't give it to people. There's not enough research about that. But at least for the person who has been vaccinated, you're protected in terms of maybe you won't get sick at all, or maybe that even if you do get sick, it's not so bad. So is it worth it? Absolutely. And in summary, I'm just more than excited to get this done. And I'm going to try and do a daily vlog. I'm committed to doing 10 days every day. I might just do it all the way through till, I guess, the recommended 14 days after my second booster, was my booster shot on this the second shot. But I'll definitely do this entire week, and then I'll update you guys. I'll tell you how I'm feeling and everything. And hopefully when we get there, they'll let me record and video me actually receiving the injection. So we'll see how it goes. But I'm really stoked because I've got a couple coworkers, including my I guess I don't want to say his position out loud, but like one of the top director guys at our clinic is going to be going with us. So there's going to be the four of us who work together who's going to be going together and getting this vaccination. So hopefully we'll get some good footage, and I'll see you guys there. All right.